In this short talk, we'll be talking about some less common variants of Alzheimer's disease, in particular logopenic aphasia and posterior cortical atrophy. We'll start with the latter. So, if you're a neurologist and your patient comes in saying things like this, my vision's definitely blurry, but my eye doctor says I'm 20/20. My eyes just get really tired and it's hard to focus on small print. When I go driving on a sunny day, I can't stand it because the glare off the other cars is so annoying. It actually really hurts to look at. And when the patient's partner says something like they notice that she's having to look a few times at a shelf in the refrigerator to find something that seems to be right in front of her, this is something to think about. It's an unusual disease, and rarely it can even cause extremely unusual symptoms like micropsia, the perception that an object is smaller than it actually is in reality, palinopsia, this kind of shadowy afterimage that follows the movement of any object. And more generally, just very severe deficits over time in all kinds of visuospatial tasks. In this one, you can see that the patient's been asked to copy the figure at the top of the page, and that their attempt at the copy is very distorted. Um, I had a patient with posterior cortical atrophy who I asked to interpret this picture, tell me what was going on in the picture. And she interestingly kind of traced, starting with the woman doing dishes with her finger, and said that there's something wrong with the sink. And then she moved on to the kids. And then later she noticed the spill of the sink on the floor. And she said, there's something funny on the floor, maybe a little rug. She wasn't able to connect the sink to the water overflowing the sink to the spill that had gone down. And this inability to perceive all the elements of a visual scene together is called simultagnosia, and it's a common characteristic of patients with this disorder. Here's another test that we sometimes use called Navon letters for simultagnosia. A patient with posterior cortical atrophy might look at this figure and say, I see M, I see lots of M's, but they might not be able to tell that together all of those M's are making up another larger letter, the A. Um, Patients often have trouble with putting on clothing correctly and with using objects in space. I had a patient in clinic recently who removed her name tag, or it had fallen off, and when she put it back on, it was upside down, and she didn't notice. As I mentioned, they also have trouble getting on clothes, and things that we take for granted, like knowing which way is forward and how to orient the sleeves, become very difficult for these patients. Posterior cortical atrophy is a relatively newly described disorder. Um, oh, sorry, one more deficit that you'll often see. If you look at these panels, try to imagine how your eye would track the image of the pier and the people on the beach. Um, Probably, if you're a normal, healthy person, your eye would track the figure just as in the top panel A. You look for the most interesting elements of the picture. You're looking at the people on the shore, looking down at the end of the pier. Someone with posterior cortical atrophy has trouble consciously guiding their eye movements to the interesting elements of what's in front of them. So you can see that in panel B, the eye there that they're recording is dwelling a lot on the end of the pier and then kind of going off into the water, and the person never even ends up focusing on the interesting figures on the shore or anything taking place there. These patients also have trouble mimicking hand gestures, and so often if you ask them to tap the front of their hand to the back of their hand and back and forth like the patient in the bottom panel is doing, they'll have trouble just imitating that posture. Making more complex two-handed finger shapes to imitate the examiner is also something that's really hard for them. And as I was about to say, this is a disorder that we haven't known about for a very long time. It was first described in a case series by Frank Benson and his colleagues back in 1988. And you can see that the CT image that they're showing here shows a lot of atrophy in the very back of the brain. I think it's the most easy to see on the right side image. If you look towards the back of the brain, which is towards the bottom of the screen, you can see that there's a lot more space between the gyri at the back of the brain than at the front. And more recently, we've been able to do much more detailed characterizations of where the atrophy is in this illness. And you can see that the areas of atrophy are in green. The top row represents patients who aren't too sick yet, they just have mild cognitive impairment. And the bottom row is patients who've progressed into the mild stages of dementia. And that the atrophy really starts to affect these visual areas at the back of the brain and then spreads up into the parietal lobe and down into the temporal lobe as the patient gets sicker. You'll notice that in the coronal image, the third image in each row, you can start to see the hippocampi getting involved. Those green blotches in the bottom row, third image, are the mesial temporal lobes, which we know are affected so early and so profoundly in amnestic Alzheimer's disease, but they're not so affected yet in mild cognitive impairment for these patients. So it seems like there's a really different pattern of atrophy here, one that's very focused around visual deficits. In terms of logopenic aphasia, the other Alzheimer's variant we're going to talk about briefly, let's just touch on or review what aphasia is to begin with. It's a general term that means any speech or language disorder that's caused by a problem with the brain, as opposed to, for example, with the muscles moving the tongue or something like that. In the syndromes that we study at the Memory and Aging Center, which are mostly the primary progressive aphasias, those are neurodegenerative diseases where language problems are the most prominent clinical feature. And so logopenic aphasia is one of these primary progressive aphasias and one that happens to have underlying Alzheimer's disease in most cases. So I'm going to take you to YouTube for a few minutes of a patient with logopenic aphasia describing what it's been like for her.
I used to work in a school in the office, and I was there for about 22 years or something like that. And about 5 years before I left, I felt that I was called to be a priest. So now I am I am a priest. I'm not actually the vicar, because I don't get paid. I'm not in charge of the parish. But I can take the services. I can't read very well, so I haven't seen a book for about 3 years. I can't read a book. I can say the words sometimes, and sometimes I can't. And in a sentence, I can't make it make sense. Even I can say each word, I can't make them say what it's supposed to say. It's just like duh, 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 duh. It doesn't come, not as if, it doesn't mean anything. And I can't remember just everyday words. It's not like when you can't remember somebody's name. It's not like that. It's just like that, a word like table or the window or things you've said all your life. And suddenly you can't. And then one day, there's one word I can never remember. It's thing when actually I can't even say it. I know what it is when they're in a building. They whatever it is, and I've got it written down in my phone, and I look at it and I try and say it, and sometimes I can say it and sometimes I can't. I know what it is, all these things I know, but I just can't say the word, or just not remember it, or can't say it, one or the other. There's two things. It's one thing saying it one way, or just not knowing it. There's two different things. So it's very annoying.
So she describes her experience very eloquently, but a few things that you might want to take special note of. You might have decided that her speech was a little bit slow, and she certainly pauses sometimes, but in general her speech is still grammatical. She clearly has some trouble coming up with words, and she's very aware of this. She knows that it happens. She has strategies to help herself out, like writing down words that she knows she has trouble with on her phone so she can look at them. Another thing to note is that when she does make a speech error, like when she said vigor, meaning vicar, and then corrected herself, the mistaken sound is still a sound in English. It's not what we call a speech distortion, which is a non-native language sound. Something else to know about people with logopenic aphasia is that they have a lot of difficulty with repetition, not so much for single words, but for sentences or phrases. It seems that the machinery in the brain that helps us hang on to a lot of syllables in a row, such as would happen with a long phrase or a sentence, is having a lot of trouble. And so if you said to one of these patients a single word like fictional, they could say it back to you with no problem. But if you said something longer, like a simple sentence like the pastry chef was elated, they would have a lot of trouble repeating that back to you. And Dr. Gorno Tempini at the Memory and Aging Center, who's done a lot of really pioneering work in primary progressive aphasia, likes this particular sentence because it illustrates so often that people with logopenic aphasia, even though they can't repeat it directly back to you, keep what she calls the semantic trace of the sentence. So the patient in this case might respond, The person in a bakery, the baker was very happy. So they know exactly what you're trying to say, but they just haven't hung on to those specific syllables that you used to say it with. This slide shows you a summary of the diagnostic criteria for logopenic variant primary progressive aphasia, and this is from Dr. Gorno Tempini's work. And we've talked about a lot of these key features. So, in terms of the core features, people have trouble coming up with words. They have trouble repeating, especially for sentences and phrases. Moving on, they make some speech errors, but phonologic errors rather than speech distortions in their spontaneous speech, and also if they're asked to provide a name for an object in front of them. But they have no trouble understanding if you say a word, they know what you mean. Their motor speech is fine. Again, no distortions of speech. And their speech in general is grammatical. In terms of atrophy in these patients, regions that are really critical for language functioning, and especially those right around where the temporal lobe meets the parietal lobe, which is pretty much where that hook is in the blue area that you can see in the second image in each row, those are affected early. And it seems that the brain's way of keeping what we call the phonological loop, keeping our memory of syllable by syllable along complex phrase or sentence, is right around that area of the hook too. And so that's affected very early on in this illness. Because the language areas that are affected are really close to other important brain structures, you can sometimes see other symptoms from the nearby dominant inferior parietal lobe and other areas. Things like difficulty with mental arithmetic. And so people with problems with the angular gyrus don't have trouble remembering 6 times 6, times tables that you learned as a child, but they do have trouble doing mental actual calculations like the ones shown here. They might have trouble telling left from right and knowing fingers from other fingers. So, for example, if you ask them to show you their right ring finger, they would have difficulty with that. And they might have trouble with writing, which we call agraphia, in addition to other symptoms.